My name is Dr. Karen Harkaway, and I'm a dermatologist practicing for the past 25 years in private practice. It's a game changer for us in terms of treatment of melasma because previously there was nothing that addressed dermal melasma, and many people have a combination of both. I mean, obviously we could do reasonably well with epidermal melasma using IPL, hydroquinone, retin-A, peels, or any combination thereof. It was time consuming, but we generally could get it under control. But people who had dermal melasma, it was just kind of throwing up your hands and say, nothing's gonna help. Now, we definitely see an improvement even in the most difficult cases, and that's been very gratifying. For the demo day, I had a very difficult case, an 85-year-old. She had dreadful melasma, dermal melasma, that was extremely dark. Her natural skin color was probably a type 4 to 5, and this melasma was type 6 for sure. I've treated her 3 times now. She has significant improvement. She's just overjoyed, and of course when I first came in and said, okay, here's our demo patient, you know, they kind of looked at me like, wow, you're really putting us to the test here, but she did well. I definitely just see so many of my patients like looking better. We're treating for one thing and yet so many things improve, and they're so thrilled with it. The patients can see right away the difference in their texture, the oiliness, the tightness of it, and then the decreased pore size, which is something that I rolled my eyes at for 25 years because there's never been anything that can truly decrease pore size to my knowledge. But I have to say that this absolutely does, and that's a great thing because so many people are unhappy with that aspect of their skin. I actually love this term neo-foundational therapy because I do think that this laser represents the foundation of treating so many different conditions, both medical and aesthetic. Aesthetically, let's just say, you're talking about tone, texture, and laxity, and those are 3 of the 4 aesthetic concerns, lines being one as well, and actually it helps with lines as part of typing. On the medical side, being able to treat inflammation is a foundation for what we do so many times. If you had to have one device in your practice, this would be the one to have. Obviously, getting results is the gold standard, and so being able to see on my website or in my video loop in the waiting room to see before and afters that I've been able to obtain that are very good really is a home run with the patients in our practice. This device allows people to view my practice as extremely forward-thinking, cutting edge, and I think that means a lot to a lot of people these days.